Assalamu alaikum. I am Dr. K.M. Julfikar Hasan, lecturer, Pathology Department, Boshundara Addin Medical College and Hospital. Today I will discuss about the hepatobiliary system and my topic is gallbladder. Firstly, we know the congenital anomalies of the gallbladder. Gallbladder duplication with conjoint or independent cystic ducts. Then a folded fundus is the most common anomaly, creating a pharyngeal cap. Agenesis of all or any portion of the hepatic or common bile ducts. Choledochal cysts. Now, what is cholelithiasis? Stones in the gallbladder, that is called gallstones. More than 95% of the biliary tract disease is attributed to gallstone. There are two general classes of gallstone. Number one, cholesterol stone and pigment stones. What are the risk factors for gallstones? Cholesterol stones risk factors are Northern Europeans, North and South Americans and Native Americans and Mexican Americans are most prominent. Advancing age group, female sex hormones, female gender, oral contraceptive pill, pregnancy, obesity, metabolic syndrome, gallbladder stasis, hyperlipidemia syndrome. These are the risk factors for cholesterol stones. And pigment stones, Asians are more than Western people. Chronic hemolytic anemias, rural peoples are more affected than urban peoples. Biliary infection, gastrointestinal disorder like as ileal disease, ileal resection or bypass, cystic fibrosis with pancreatic insufficiency. These are the risk factors for pigment stones. What are the pathogenesis of cholesterol stones? Cholesterol stone is soluble in bile by forming micelles with bile salts and lecithins, both of which act as detergents. When cholesterol concentrations exceed the solubilizing capacity of bile supersaturation, then nucleates into solid cholesterol monohydrates crystal. Four conditions appears to contribute to formation of cholesterol gallstone. Number one, supersaturation of bile with cholesterol, hypomotility of the gallbladder, accelerated cholesterol crystal nucleation, hypersecretion of mucus in the gallbladder. What are the pathogenesis of pigment stones? Complex mixture of insoluble calcium salts of unconjugated bilirubin and inorganic calcium salts, elevated levels of unconjugated bilirubin, chronic hemolytic anemia, or bacterial contamination of the biliary tree. These are the pathogenesis of pigment stones. These infection of the biliary tract with E. coli and Ascaris lumbricoides, hemolytic anemias, the secretion of the conjugated bilirubin into bile increases. About 1% of the bilirubin gluconides are decongested in the biliary tree, and in the setting of chronically increased secretion of conjugated bilirubin. A sufficiently large amount of deconjugated bilirubin is generated to allow pigment stones to form. What is the morphology? Cholesterol stones arise exclusively in the gallbladder and range from 100% pure down to around 50% cholesterol. Pure cholesterol stones are pale yellow, round to ovate, have a finely granular, hard external surface. Stones composed largely of cholesterol are radiolucent. Sufficient calcium carbonate is found in 10% to 20% of cholesterol stones to render them radio-opaque. Pigment gallstones are brown to black. In general, black pigment stones are found in sterile gallbladder bile and brown stones are found in infected large bile ducts. Approximately 50 to 75% black stones are radio-opaque due to calcium salts, while brown stones which contain calcium soaps are radiolucents. What are the complications of gallstone? Number 1, cholecystitis. It causes empyema or perforation, fistula, inflammation of the biliary tree, that is called cholangitis, obstructive cholestasis, pancreatitis, intestinal obstruction, and increased risk of gallbladder carcinoma. Now, what is cholecystitis? Cholecystitis is inflammation of the gallbladder. It has 3 types: acute cholecystitis, chronic cholecystitis, acute superimposed on chronic cholecystitis. Acute cholecystitis is precipitated in 90% of cases by obstruction of the neck of the gallbladder or the cystic duct by a stone. Cholecystitis without gallstones occur in severely ill patients, accounts for the remaining 10% of the cases. That is called acute cholecystitis. Acute acalculous cholecystitis is thought to result from ischemia. What are the risk factors for acute acalculous cholecystitis? Sepsis with hypotension and multisystem organ failure, immunosuppression, major trauma and burns, diabetes mellitus, and infection. Now, chronic cholecystitis. Chronic cholecystitis may be a sequelae to repeated bouts of mild to severe acute cholecystitis, but in many instances it develops in the apparent absence of antecedent attacks. Since it is associated with cholelithiasis in more than 90% of cases, the at-risk patients population is the same as that for gallstones. What are the morphology? Subserosal, it can be subserosal fibrosis. The wall is variably thickened and has an opaque grey-white appearance. On histologic examination, mildest cases, only scattered lymphocytes, plasma cells, and macrophages are found in the mucosa and in the subserosal fibrous tissue. In more advanced cases, there is marked subepithelial and subserosal fibrosis accompanied by mononuclear cell infiltration. This is the figure showing the chronic cholecystitis. There is extensive dystrophic calcification of the gallbladder wall. There is complete replacement of the gallbladder wall and mucosa by dense fibrosis, that is called hyalinizing cholecystitis. Increased incidence of gallbladder carcinoma. Clinical features: recurrent attacks of epigastric or right upper quadrant pain, nausea, vomiting, intolerance for fatty foods are frequent. Complications of cholecystitis: it can be cholangitis or sepsis by bacterial superinfection, gallbladder perforation, local abscess formation, diffuse peritonitis, and biliary enteric fistula. Aggravation of pre-existing medical illness with cardiac, pulmonary, renal, or liver decompensation. Now, carcinoma of gallbladder. Carcinoma of the gallbladder is the most common malignancy of the extrahepatic biliary tract. The most important risk factors for gallbladder cancer is gallstone. Gallbladder cancer are mainly adenocarcinoma and are most often detected in the fundus of the gallbladder. They may produce a firm, wholly circumscribed masses or may diffusely infiltrate the wall of the gallbladder, stimulating the gross appearance of the chronic cholecystitis. Today is my topics. Thank you everyone for listening carefully.